Hello, everybody. This is Brian Devine from Top Line Management, and today I have with me Dr. Blake Maxfield, who practices in both Taylorsville and Cottonwood Heights area, to talk to us about Invisalign. So let's just jump right in. Thank you so much for taking some time today, Dr. Maxfield.
You're welcome. Thanks for having me, Brian.
Absolutely. Glad to have you. I think a lot of people are hearing about Invisalign. They have questions about Invisalign. So let's just start with, what is Invisalign?
So Invisalign's, I'm sure a lot of you guys have heard about it, but it's the newest, the latest and greatest in technology. All of medical fields are progressing, and orthodontics, we are too, and we finally figured out a way to straighten teeth without those braces that everyone loves.
Yeah, exactly. Especially if you're an adult, boy. The idea of having braces is pretty rough.
Exactly.
Perfect. All right. So why is it that you are offering Invisalign in your practice in particular?
I'd say, these days, with, you're an adult, you're giving presentations at work, or, we find a lot of people are out there singing for a living, or they have a wedding coming up. There's just a lot of different times in your life where you just cannot do braces to move your teeth, and you can't sacrifice. You don't want to sacrifice, but you still want to tweak your teeth a little bit and have that perfect smile you've always desired. So that's why we offer Invisalign. We want to give that option to all of our patients.
Wonderful. Now, what makes your practice unique when it comes to treating with Invisalign? Obviously, they're seeing it probably everywhere right now. What makes your practice different?
Sure, yeah. So you can go into any dentist these days, and most dentists are offering it. All my friends who are dentists are pretty much offering Invisalign. The thing that separates, the dentist from the orthodontist, and I'm not saying there's not a place for my friends who are dentists that are doing it. There are definitely some mild cases that their results are turning out just great. But, as a specialist, as an orthodontist, I have the training. I understand what tooth movement is, and, the 4 dimensions of tooth movement. And, there's just a lot more that goes into moving teeth than just letting the computer do it. So,
yeah.
My friends who are dentists that are doing Invisalign, they send it off to the lab, and Invisalign, the tech, sends it back to them, and they kind of just, a lot of times they'll either ask me, or they'll be like, is this going to work? They don't know, and there's certain little things that, of course, they're going to work. But the advantage to a specialist is we can go back, we go back to the tech, and we're like, no, slow that movement down. That's not going to work like you think. And, we kind of do it together and work out a plan so that we can give yourself, that perfect smile.
Yeah, fantastic. In my experience with Invisalign, it's kind of the same. I have worked there in the past, and having a specialist with an eye on things, working with the tech, was a much better end result. So I give you a lot of credit for taking the time, because it does take quite a bit of time to do that.
Well, thanks. And yeah, I feel bad because Invisalign is a great product. It's improved over the years, but it sometimes gets a bad rap because it didn't work for that patient, and I just feel bad because a lot of times it's not going to work perfectly from the beginning, but you have to be able to adapt as you go. And if you have that extra experience in moving teeth, you know how to kind of adapt things as you go to make it continually work and to end up with that perfect result.
Fantastic. Now, if I'm watching today, how do I know if I'm a good candidate? What would you say is sort of like that best or ideal candidate?
Yeah, with Invisalign getting better and better and the technology getting better, I would say the majority of people are candidates these days, but sure, there's always that case, with the bite that's really off, that Invisalign may not be your best option, but most cases are candidates these days, like I said, with the technology getting better. But the best way to find out is come in and get a free consultation from me or another specialist and see what we say. Some of us younger orthodontists, I'm a little bit younger, so in my residency we were trained on Invisalign, and so where a lot of times people are saying they're not candidates, that's not true. Just because they don't feel like they can make it work in their hands, it still could work.
Yeah. So if I'm listening and I was already told that Invisalign is not going to work for me, that braces are my only option, you're just saying give you a call and take advantage of that free consultation. Find out for sure.
Call the number at the bottom here and give a free consultation. I'll be honest. Like I said, not every case is a great candidate for Invisalign, but you'd be surprised, if you're willing to wear some rubber bands, and there are certain limitations with Invisalign, certain movements that aren't quite as good yet, but as long as you're willing to go along with certain things, we can still make it work and make it so people don't know you're wearing anything and your teeth are going to be moving.
Right on. Yeah, no, that sounds great. Hey, before I let you go, if anyone's watching this hangout, is there any special other than the free consultation that they can take advantage of?
Yeah, if anyone's watching this Google Hangout, yeah, I would say we would give free bleaching to anyone. So after your Invisalign's done, we'll give you the trays, we'll give you the bleach, and we'll get you that perfect smile, and just remind us how you found us, and we'll definitely be good for that offer.
Fantastic. All right, so you get a great straight smile. Nobody knows about it, and they're white.
Yeah.
Fantastic. Okay, I love it. All right, so everybody, take advantage. Get in touch. Call the number you see there at the bottom, the 801-263-1333. Give Dr. Maxfield a call. Tell him that you saw the hangout so you can get that free bleaching, so you have that white smile along with the straight teeth when you're done with treatment. Thank you so much for taking the time with us today, Dr. Maxfield.
Thanks for having me.
You bet. All right, bye for now, everybody.